and welcome to Legal Affairs. My name is Diamond Liddy, and I'm the public defender of the 19th Judicial Circuit. We have a wonderful show today. We've kind of started out the new year with introducing all our latest and greatest replacements, if you will, for some of the very, very important roles in our community. And we have an introduction today. Our hands clinic, which Dr. Palestrant is going to talk to us about and explain what that is, has gotten a new CEO, and that happens to be Dr. Kenneth Palestrant. Good morning, welcome.
Good morning, thank you.
And you are, what is your official title?
Replacement.
No.
I'm the executive director of the Hands Clinic.
Okay.
It's an administrative role.
And I want to talk certainly about your background and what you did before you got in this very important role. But not that what you did before wasn't important, but what does Hands Clinic stand for, and what does it do? Because the community doesn't, a lot of people don't know.
No, they don't. The Hands Clinic is the Health Access Network organization that was started about eight years ago.
Right.
And it's a volunteer in medicine clinic. The volunteer in medicine clinics, there's one in Martin County, there's one here, there's several of them around the state. Almost every county has their volunteer in medicine
Oh, you
clinic.
know, I didn't know
There's
that.
A national,
wow.
There's a national organization. There's some funding through the state that is provided to these volunteer in medicine clinics. It's a nonprofit organization, and it was started 8 years ago. It's going into its 9th year.
Well, let me stop you a minute. Are all of them called Hands Clinics?
No,
or?
no.
Oh,
Hands,
okay.
The Hands Clinic is specific for St. Lucie County.
Okay, great, great.
Most of them are called VIM, volunteer in medicine clinics, those kind of things.
Okay.
But the clinic itself serves the population that kind of falls in between the people who can qualify for Medicaid, for example, and the people who are working and are unable to afford their health care insurance premiums.
Right.
80% of the people who attend that clinic work.
Right.
And so we really feel a tremendous need in the community. It's
not all homeless people or that.
No, no.
Okay.
No, it's interesting because that was, I think that's the impression of the majority of the people out there is that, you know, it's people who are living in the woods and things like that, and the very, 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 very poor. The very poor, there is the safety net of Medicaid, although it's not always the greatest form of health care.
Right.
But these are people, because the way the Hands Clinic works, and any of the volunteer medicine clinics work, is the patients need to be qualified. And this is very important for people out in the community to know. They can't just walk in and say, I'm here and I want to see a doctor. They have to be qualified. And when they, meaning qualified, if they have any other form of health insurance, for example, when somebody reaches age 65 and they have Medicare, we can no longer see them.
Right.
If they have Blue Cross or any other health insurance, we can't see them. If they have Medicaid and they qualify for Medicaid, we can't see them. So it's that group in between.
What about Obamacare or what?
Same thing. Yeah, Obamacare is just another form of Blue Cross has Obamacare programs.
So they have to literally have
no insurance whatsoever.
Period.
Yeah,
wow.
No, and there's means testing. So they have to bring in documents that show what their income is, and we have navigators who work to help them through that process. So when a patient wants to attend the clinic, they need to bring in some paperwork. They need to bring in documents, identification, those kind of things, internal revenue forms if they have them, and then once they're qualified and they're plugged into the system.
Are these documents sworn to? I mean, is there a problem if they how do you vet out those that may not be truthful?
Well, it's a good question. I've just been on the job for 2 days now,
yes,
so that's
I know,
one of the things that we're gonna probably have to look at. But I'm pretty sure. I mean, it's always hard, you know. If somebody produces an Internal Revenue Service 1040 or whatever, we have to assume with their Social Security number and that it's a
Oh yeah,
correct,
yeah, yeah. And don't get me wrong. You know,
Yeah.
it's in our business with public defending. To apply for a public defender, you have to fill out a financial affidavit, list
Okay,
your assets,
okay.
liabilities, all of those things, and then you notarize. It's notarized and sworn to, and you know, the penalty, if you will, if you lie, if you're living on the water in your
Yeah.
$2 million house and apply for our services and we find out the state attorney's office can prosecute you. Have I ever heard of that? No.
Yeah.
But let's face it, most people, which is kind of, I think, what you're saying, most people that are there are legit and they're there for a reason. They can't.
Yeah.
They need health care and
Oh,
services.
yeah.
You know.
I started working there as a volunteer physician about a year ago. Yeah, just about a year ago. And it was quite an eye-opener for me. Having been in the healthcare field for, 30 some odd years now and been in this area for 25 plus. So I've got a lot of background taking care of patients, and these people are really very appreciative of what we have to offer them,
I know.
which is it's a plus. And it's very gratifying to be able to make an impact on their lives. And
Sure.
some of them are very sick. I mean, there's a lot of them who are very, very ill and have no place else to go for that
Right.
matter. Now, we do have a nice group of physicians, specialists in the area. The local hospitals donate in-kind services,
Right.
lab work and imaging studies, and we have a very dedicated group of physicians in the community who do provide this free care or discounted care to these people when they have to be referred to specialists.
Well, let's talk about that for a moment. So you say it's not totally free, or it's free to some,
Yeah.
and on a sliding scale based on
No, there's no cost involved at all at the Hands Clinic at our clinic. When we refer out to for lab work and imaging studies and things like that, the majority of things the hospitals do on a donation basis.
Wow.
So it doesn't cost the patient anything, and we're talking a significant amount of value.
Yeah.
There are several specialists in the area who see these people free of charge. There are some that give them a significant discount.
Right.
So if it gets to that particular point. One of the other programs that is truly amazing is the medication program. Is called MedData. So the drug companies under the Medicare Part D that was passed many, many years ago
Right.
were required to put a pool of money aside to subsidize certain medications that were unaffordable to people who needed those medications and could not
Right,
afford them.
right.
Such as, for example, insulins. If you're a diabetic and you're taking insulin, some of those things are cost prohibitive. I mean,
Oh, well, I just read an article in the Times, I guess it was yesterday. There's a big to-do about the cost of insulin and I guess how they're trying to, require that it be, the cost be reduced. Because
well, there's so much technology and there's so many new medications coming out there. So, I mean, there's people are taking shots like once a week and things like that. So,
Right.
But the problem is they're very expensive. So the MedData program that is administered through our clinic provides medications, certain medications, very expensive medications. One of them is we have a program there where there's a physician in the community who runs a HIV testing, Dr. Modi Ramgopal, and he has people come in and they, on 1 day a week, do free testing for HIV and Hep C. Now, we can order that stuff ourselves, but he does that testing. Hepatitis C is a indolent disease that's prevalent throughout many age groups. The problem with hepatitis C is that once you've got it, in the past there was no cure.
Right.
So you developed cirrhosis and liver failure potentially, potentially liver cancer. Well, years ago, there was a medication that's come out. Now there's several. This medication called Harvoni that essentially gives about a 95 to 98% cure with a 12-week program of taking the medication once a day.
That's amazing.
That is subsidized by our clinic, by the pharmaceutical companies. The medication alone is about $75,000 to $100,000 for the treatment.
Whoa.
Yeah, yeah.
Wow.
So we provide, through that Med Data program, probably close to about $500,000 in medication subsidies alone to the community. The latest figures that we have gone through, because I'm also on their board of directors and was on their board of directors prior to becoming the executive director, is we provide almost $15 million in-kind services to the people in the county, in the area.
Wow. Well, now, is there a cap? I mean, for that pot, let's say, for medicine prescriptions, whatever, Hep C treatment, is there a cap on that? So let's say John Doe comes in, you know, one day too late, and sorry, John, we've already used all our money. You'll have to come back a year from now and get on. I mean, how does that work?
As far as the medications?
Well, do you have to turn people away? Or?
No. We're actually trying to increase our volume and get the word out to the community that we have this program in place.
Wow. Okay.
So the access, getting the word out there, because a lot of people don't know about it.
Right.
You know, it's interesting. As I said, I've just been involved with them as a volunteer physician for a year, been on their board of directors for probably about 6 months, maybe less, and just stepped into the executive position just 2 days ago.
Right.
So a lot of it is a learning curve, but it's amazing. Even though the clinic is located in Fort Pierce, 56% of the people who attend that clinic are from Port St. Lucie. So it extends all the way down. I mean, it's county coverage.
Okay.
There's county coverage, and it's not just a Fort Pierce clinic per se.
Right. Right.
But yeah, we have the capacity to see more patients. We have you know, electronic medical record that's up to date. We have this Med Data program. We can't do too many procedures and things in the clinic, but for the most part, like a general medical office, it runs just as very similar to a family practice office.
So can people come to you in emergency situations, or should they go to the emergency room if they fall into this?
That's a good question. It all depends on what's an emergency. You know, I'm sure you know my background. I was the medical director of the emergency department at St. Lucie Medical Center for 10 years before I opened up my urgent care centers. An emergency, you know, sometimes defined by the patient themselves. So,
sure.
You know, they think it's an emergency.
Well, okay, a broken arm.
A broken arm,
an emergency,
you go to the emergency department. Yeah.
Okay.
Yeah, a cold, a sore throat, a cough, you don't go to the emergency department.
Right, right.
Now, the thing is that if you are registered with our system and already have been qualified, then yes, you can come in and see us.
And get your arm?
We don't do walk-ins per se.
Oh, okay.
Okay. But they can get an emergent appointment. So somebody comes in with a sinus infection and they need to see somebody, they can usually get in pretty quickly.
Okay.
But they can't just walk in. That's the fallacy that occurs with this. There's kind of a disconnect sometimes between some of the other physicians in the community and the clinic, and myself included at one point.
Right.
I mean, when I worked in the emergency department, and you know, we would tell people to go to the free clinic or something like that, we assume that they could just go in there and walk in. But once again, they have to be able to qualify. So they have to go through a process with what's called the navigator.
Right.
And once they're registered as a patient, then
they're good to go.
Then they're good to go.
Now, does this include surgeries?
No, we don't do any surgical procedures.
Okay.
A lot of the hospitals, though, sometimes if we have somebody who needs a surgical procedure, sometimes with a little bit of cajoling and pushing, we can get something done.
Some help.
Now, we do have an agreement like with Moffitt Cancer Treatment
I was just going to ask about cancer. Okay, go ahead.
So if we have somebody who's been diagnosed, okay, so the diagnosis has to be achieved within our clinic or within our group of specialists.
Right.
and they come up with an actual diagnosis of what kind of cancer it is, which is usually a histologic diagnosis, you know, from a pathologist or whatever the case.
Right.
Moffitt will take those patients and take treatment. So there's been there's been a lot of success stories through the years, you know, and it's a great organization. The staff there are tremendous. They're very dedicated people.
How big is your staff, doctor?
We've got about 15.
All the full time there?
Yeah, there's the ancillary staff, administrative people, and medical assistants. But we've got a lot of volunteers. We've got volunteer physicians. We have volunteer nurse practitioners. We have some paid nurse practitioners. We have medical students. We have nurse practitioner students. We have nursing students that come through there. We have residents who come in and do rotations.
Oh, right.
So it's a learning experience for them because they're in their process of doing their residency and doing a rotation, and then we're able to utilize their skills also at the same time to provide the medical care.
Right. Well, you know, I think the first job you have, the first thing you need to do on, you know, in your new position is really to get this word out and to let the community know. I mean, obviously because of what I do, I knew what you did and the Hands Clinic did. And we refer clients, obviously, to your clinic and things of that nature. But as much as I knew about you and the clinic, I didn't know all the details.
The details,
oh my gosh! I mean, it's tremendous. Now, what about teeth?
Yes, that's another integral part of the clinic. So it's not just medical care. We have volunteer dentists. There's a complete dental suite that you would see in any type of dentist office. They do teeth cleaning, they do evaluations, they do dental extractions. Once you start getting up into some of the more esoteric and
well, you're not going to get implants at the Hands
You're not going to
Clinic.
get implants, you're not going to get bridges and things like that. We're trying to work on allowing people to get dentures made, that kind of thing.
Well,
but we've got a very active dental program. In addition to that, we have somebody out in the community who full-time goes out and examines kids in the school districts. He goes to the different schools, sees about 10,000 kids a year. He's a dental hygienist who actually there's a grant through United Way that provides the funding for him and his assistant. And they go out, and that's all they do is they examine kids in the schools. They do oral examinations. They do sealants. And you know that's a big part of it. I mean, you know, get those kids early before they're
well, how do they pick who they? You know, it's funny because when Andy Passeri was the CEO, I had him on the show, and I think he talked about that. I was like blown away. But how do they pick what children they see? I mean, how do you vet that?
As far as the screening in the schools?
Yeah, I mean, or do teachers, like that person goes around in the school district and Miss Smith says, I think you need to see Cindy because, you know, her teeth are bad or something.
I'll be quite honest with you. That's one of the things that
you don't,
on my learning curve. But, yeah, I know that he has seen last year almost 10,000 students within the school. Yeah,
and for free.
Yeah, exactly.
Wow.
Yeah.
Well, believe it or not, we've got about less than 10 minutes left. And I have some other questions, which I'll get back to in a minute because it's important. But tell us about you. We jumped right into the meat of the matter. I mean, what's your background?
Well, you know, I started my career out way back in Miami working as an orderly in the hospital, in the ER. And I went on from there. I became a paramedic. I worked in Broward County EMS for 4 years. I got my nursing degree. And then I went off to medical school.
Wow. Okay.
I did a year of training in St. Louis, Missouri. And then I did 3 years of training up in Jacksonville, up at the University of Florida affiliated hospital up there. It was called University Hospital at the time. Now it's Shands Jacksonville.
Oh, yeah. No, I know.
Yeah. And I started working in the emergency department in Lake Worth, Florida. I did that for 3 years, and then I got a phone call one day from an acquaintance who was here at St. Lucie Medical Center, and I started working up here in '93. In 1993, I started working in the ER and spent 10 years there. And in 2003, I decided I was going to, well, I had decided a couple years before then, but I left the ER. And, oh, by the way, while I was at the ER, I also did some part-time work at Savannah's. So we did some of the...
which is the...
Yeah, now it's what, Port St. Lucie Hospital?
Well, no, but I mean, it's the...
Oh, Savannah's was a major psych hospital in the area.
Right, a lot of people don't.
Yeah, and they needed medical evaluations done, so I had that part of it. And then in '03, I opened up an urgent care center. In '04, we had those terrible twin hurricanes, which pretty much destroyed our building. And I had a very dedicated core group of people. We all stuck it out, and we operated out of a trailer for 8 months, running the clinic. And then expanded to 5 urgent care clinics over about a 14-year period of time. Right. And then 2 years ago, HCA, that owns Lawnwood and St. Lucie Medical Center, purchased the network of urgent care centers. It's now called Care Now. Right. And I found myself semi-retired with having to do something.
Well, it was funny when we talked before the show started. You said, I said, so why did you know, of course I see that all the time, especially in the law enforcement arena. You know, they do law enforcement for 30 years and you can't wait, you know, counting down the seconds to retirement, and then they get retired, and it isn't 4 months later they're calling another agency saying, can I come back to work and do whatever? I'll answer the phone. I just, you know, I just miss it, you know, and I want to do it. So.
Well, you know, there's a couple things. I think staying active keeps you young, you know, being productive. I've got a skill that I don't want to lose. I really enjoy taking care of patients, taking care of people. Right. It's great. I mean, you know.
Oh, I mean, I can't think of anything better after, you know, because certainly this is a pressure job. I mean, I mean, are you kidding me? I can't even, you know, I'll have you back on the show.
Well, this one's not. This one's not, comparatively,
Well, comparatively, you know, but I don't want to mitigate the importance of your position because it's a big, big deal. But I kind of liken it in my mind to like having grandchildren, you know, right?
Right. Good analogy,
you know, I don't have any, so I don't know yet, but that's what everybody says, you know, it's kind of, it's just as wonderful, if not more wonderful than having a child, but there's not that you know, bottom line always. And, all of that.
Well, it's interesting because I didn't expect to be in this position. I started out as the volunteer physician, and which I enjoyed, and then got involved with their board of directors, which I enjoy management. I mean, I managed my clinics. We had almost 100 employees and great group of people. Right. We were seeing close to 60,000 visits a year through all the clinics. So it was busy. It was, you know, we were, and to try to maintain an organization quality, you got to be on top of it all the time. Right. So I was on top of it, and other things may have suffered a little bit, you know. I mean, you know, but so I've adapted now to my semi-retirement, where you know, enjoying my life, but at the same time, I felt that you know, it's good to stay active.
Oh yeah, and what a wonderful. I mean, that's a great group to help. You know, people who. Who are got in, you know, you hear that in the legal arena so much as well, you know. I mean, I don't qualify for a public defender, but I can't hire a private lawyer. You're right in that middle ground in the legal community. There, you know, you're kind of in a bad place.
Yeah, yeah, exactly.
There are
exactly.
there are legal services, Florida Rural Legal Services, that handle some things, but not criminal. You
Right.
know, and a very, very you know, small percentage of what's in in the criminal or justice system.
Yeah.
So
There's one other thing I wanted to add. My wife is involved with the clinic also. My
Oh.
wife, Dr. Deborah Palestrant, she's a naturopath. She has a degree in natural medicine, so
Wow.
she does that end. But she is involved with the fundraising, with some of the fundraising,
Right,
and put on
right.
some events and things like that.
Oh, yeah, we've
that's a
been
big
to 'em.
that's a big part of the community involvement.
Yeah.
And that's the thing, is that I want to put that out to the people in the community, that any donation is well spent, well managed, and is truly needed, because that's how we operate. We have all grants from the Florida Association of Free Clinics. We've got the generosity of St. Lucie County Board of County Commissioners.
Right.
The United Way. There's other organizations that we do fundraising with.
Right.
But that's the lifeblood, is the fundraising.
Right. Well, you know, that was right there.
There we go.
I
Okay.
figured we'd end with that. So at the very end, you could give a number or whatever. They could call your wife, Deborah, and say,
No, don't do that. Don't do that. She's busy working.
No, I know,
But,
but-
they can call the clinic.
Okay.
And I've got the number on my card. I don't.
Well,
remember.
go ahead and say it.
I'll have to read it.
Okay. Well, I think it's up on the screen
Oh, okay.
right now.
There you go. Okay. Oh, perfect. All right. Okay.
Okay, so
Yeah.
they could call the clinic if they're interested in donating, or their time, their money, whatever.
Oh,
I'm
yeah.
sure
Yeah.
you can use volunteer.
We can use volunteer time too.
Right,
Yeah.
right.
I mean,
And you
know.
don't have to necessarily be a doctor.
No. If there's physicians out there, or medically oriented people who would like to donate their time, we're always open for that. But any volunteers would, administrative, we have a cadre of people who do volunteer, and it's always good to have some extra help there.
Sure. Now, the bulk of your fund, though, doesn't come from private donations, does it?
No, the bulk of the funding comes from the county here, St. Lucie County.
Okay.
And the Florida Association of Free Clinics. That's the majority of it. The United Way kicks in some money. They also have a specific grant for the dental program also.
Oh, okay.
And then there's a few other organizations with smaller grants. And then our fundraising brings in a chunk of money
Supplement.
too.
And now, what about the state? Does the state give you?
Yes, the state is the Florida Association of Free
Oh,
Clinics.
that's the money from the
funding.
okay.
It's a funding source that is set aside by the state, and
Okay.
but is divvied up amongst the free clinics. And the
Oh, I gotcha.
the more free
Okay.
clinics that open up, it
Dilutes.
dilutes it. Yeah.
Sure.
And there's estimates of 72,000 uninsured individuals here in St. Lucie County.
Oh,
which is
I'm not.
pretty significant.
I'm not surprised.
Yeah.
Well, believe it or not, we are just about out of time. So thank you. This has been wonderful. I'm going to have you on the show a year from now to catch up and see how you've done. But best of
good.
luck, Doctor.
Thank you very much. Okay.
Thanks.